Early Show continues now from the General Motors Building in New York City.
This morning in Health Watch, groundbreaking advances in genetic research are leading to new ways to treat disease. Dr. Michael Kaplitt is an expert in gene therapy at New York Presbyterian Hospital, Weill Cornell Medical Center. Good morning, doctor.
Good morning.
Give us an example of how you might use genetics to establish a treatment for, let's say, heart disease.
Well, in the last week, there have been several papers that have shown new genes and new tests that could influence your risk factor for heart disease. Heart disease is a great example because there are things we know you can do now. So if you had a simple blood test at a young age that could alter your risk factor for heart disease, you might take cholesterol-lowering drugs at a much younger age. You might change some of your bad habits. So there are things you can do now with that information.
So it wouldn't necessarily create new treatments, but help you start sooner with existing treatments?
Well, it could, because these genes also give us markers or pathways to follow to understand why diseases happen. So we can develop new therapies, such as gene therapies, where we use that gene as an actual treatment.
What are conditions right now where establishing or seeing if a person has a specific gene might help in treating the disease?
Well, for example, in breast cancer, there's a specific gene that influences whether or not you will have a better response to chemotherapy, and that is being used in practice right now. There's a very specific type of brain tumor called an oligodendroglioma, which is a big word, but where there's a gene that influences whether you respond to chemotherapy. So whether we use chemotherapy as opposed to surgery or radiation up front is being changed right now.
Already?
Yeah.
Unbelievable. Thank you very much, doctor.
My pleasure.
Appreciate you
Thanks.
being here.